Now, I would like to invite Dr. Avinash DeSousa. He's the director and founder trustee at the Sousa Foundation. He's a consultant psychiatrist, consultant psychotherapist based in Mumbai. He's associated with Baha'i Academy for a number of years. His series of videos titled Psychological Impact of the Lockdown Period and 10 Tips to Remain Healthy is published in 3 languages on the Baha'i Academy's YouTube channel. A very warm welcome to you, sir. Dr. Avinash DeSousa will be talking to all of us on the topic, what dementia means to me. Over to you, dear sir.
Well, good evening, everyone, and it's an absolute pleasure to be here. In fact, I wanted to, discuss with you as to what dementia means to me, and I always say that because the neurological aspect was very beautifully described by our previous speaker. That was a more medical angle to dementia, but there is a psychological angle which is very important, and the psychological angle is that dementia is an illness that can affect anyone. It can affect someone who was a doctor, someone who was an engineer, someone who was a chartered accountant, someone who was a teacher, someone with brilliant mental faculties who later succumbs to age, decreased blood supply to the brain, and that causes a deterioration of his cognitive abilities. And you begin to feel that this was one man who was so good at one time, and now see what kind of a situation he's reached. So I've had many of my senior teachers who've taught me in school or taught me in college grapple with dementia. I've had many neighbors, uncles, aunts who I have, seen in the prime of their youth when I was small, and now seen them grapple with dementia. So dementia is an illness that affects the entire family. It's not something that affects only the patient, because the entire family is involved in the caregiving process, and that's what often causes a lot of worry to the entire family. Now, there are a few things about dementia that I would like to share. One is that dementia, while memory loss is very often a presenting symptom, it's important to remember that after the age of 60 or 65, even behavioral symptoms could be the first signs of dementia. So if you see someone get irritable, get hassled, get worried, get aggressive, and this was not their personality ever before, and otherwise their memory is intact, they're doing everything okay, it could be the first signs of dementia. You may wonder, you may very often attribute it to age and leave it, and you may not worry about it, but that could be one of the first signs of dementia. In every patient, we always ask, in your family, has anyone had dementia? So always remember, when there's a family history of dementia, your risk for dementia increases. And this is for any form of dementia. And this can be something which is, a very important marker for us to identify people who are at a higher risk to develop dementia. One thing which I tell a lot of people is dementia patients generally, unless they have medical complications, do not shift them to a hospital. Unless they have very serious medical complications or they need a lot of care, do not shift them to an old age home, because many of them do better in their own houses. They have a sense of security and feeling of care in their own house. You may have an ayah, you may have a ward boy, you may have someone to look after them in your own house, but they still feel better in their own house. I've seen them deteriorate further when they're shifted to a hospital. And this has got nothing to do with the medical treatment. This has got nothing to do with the doctor's treatment. This has got nothing to do with the treatment being offered. The treatment offered is absolutely correct. But what's very, very important is that the patient's change of environment disturbs him. So one has to be very important to realize that let the patient be at home and, provide him whatever home care you can. That's very essential. There are very few old age homes that have trained staff to manage patients with dementia. So one needs to be very particular that in a worst case scenario, if you have to shift him out, please shift him out to a place where the staff is equipped to handle him. Because we've had many instances where patients have been shifted out and staff have been rude or angry or aggressive and have not been able to manage these patients. And that has caused further deterioration to these patients. I have been working with older patients because I visit a number of old age homes in Mumbai as a visiting psychiatrist. And even during the COVID period, I've been visiting these homes because many of these people uh, in Bombay have what I refer to as PICA, PICA, parents in India and children abroad. So, most of their children are abroad. So the thing is, very often they're all alone here. And the child phones me up from England, Australia, New Zealand that please give him the best care, but the children are not able to come here to look after them. And sadly, that is a true state of affairs in our country. And what happens as a result of that is that these people are put into old age homes and put into care homes. Money is being sent every month, but the emotional connect for care isn't there. And I very vividly remember that you may have patients who forget everything. They even forget their name, who they are, and I used to have a particular patient who was a Gujarati gentleman who was 83 years old in an old age home. And he would always refer to me as Chunni Lal for some reason, and I don't know why. And so much so that whenever he would see me, he would say, "Arey, Chunni Lal aa gaye," and he would be very happy. And he would speak to me. And it so happened that by chance I happened to meet his relative who told me that Chunilal was his school friend. And he said that Chunilal used to look pretty much like you. He was on the stouter side and he was baldish. And so this fellow had that memory, that trace of memory was still there. So he would refer to me as, and what touched me the most was he fell ill, of course. He was 87 years old. I saw him for around 5 or 6 years. He fell ill. And even on his deathbed, this was around a day before he died, he asked for Chunilal and they told me, "Sir, can you come? Because, he'll feel good." And I actually came. He saw me, he smiled, he drank some tea with me, and, he was fine. Of course, he passed away very peacefully in his sleep, which was a very nice thing that happened. But I was so touched that, sometimes it's just that, small things make these patients very happy. And we sometimes have to go out of our way to build that humane touch when we're dealing with him. What's very important that I tell everyone is sometimes as doctors we forget that we're treating human beings. We're not treating bodies, we're not treating brains, we're treating human beings. And it's very important that we maintain, because I always believe as a psychiatrist, and psychiatry is one of the few branches of medicine where we combine scientific knowledge and human understanding. Both have to be combined together. And it's the only science or the only branch of medicine where a patient will come to you and tell you their deepest, darkest, most intimate secrets, in total confidentiality, that they're telling someone who's an absolute neutral person. So they surrender themselves totally to you and tell you everything about themselves. So even in dementia, we very often have to never forget that human side of caring. It's something which is very important. And I always say that uh, dementia care involves a lot of patience, a lot of perseverance. It's a team effort. It's never going to be one person alone. Even in a family where caregivers are available, I always say we need to have a group of caregivers to look after the patient, because the patient, one person doing all the work is going to burn out that person. So it's important that you have a group of caregivers. Very, very importantly, what also matters in dementia care is that the patient is always to be treated with a lot of dignity and care. So do not bother whether he doesn't remember you. Do not bother if he gets upset. Do not bother if he gets angry. All these things do happen. The patient may get disoriented. He may get upset. You need a lot of, patience when you deal with these patients. And this is something that matters. I would tell you another experience I had in an old age home, because very often when I would go to meet these patients, I would take some sweets, some wafers, some chocolates for them, and give it to them, and they would be very happy. And there was this one man who had developed dementia. His cognitive deterioration had started, and he was a 79-year-old person who I knew. And one fine day, what happened was somebody else had come to the home and distributed some chocolates. So he had a Kit Kat with him. So he actually gave me the Kit Kat chocolate, when I went to see him. And I told him, "Why are you giving me this?" So he said, I said, "You know me, who I am?" And he said, "I don't know your name, but I know you come every time and you give us all chocolates and you give us all this." So he said, "So this is for you." So I said, "Thank you." And just as I was leaving his room, the beauty of cognitive deterioration, he told me, "Do not eat it." So I said, "Why should I not eat it?" So he said, "If you eat it, it will finish then I do not have another chocolate, to give you. So, so this is the beauty of patients with dementia, that, this was someone who was an engineer, who's, now talking like this. I mean, at one time he would have said, okay, if it finishes, we'll buy a new one. But with, cognitive deterioration, the worry was, if it finishes, I don't have another one to give you. So there was some emotion, attached to that chocolate. I've had instances where I've had a photographer who had dementia, and I told his children, just keep his camera in front of him. Let's see if, it's. And he picked up the camera and started clicking photographs. I mean, now he had no memory of his son. He had no memory of his wife. He had no memory of who he was. But he was still able to pick up the camera and click photographs. Of course, I wouldn't say the photographs were A1 or very good or, of the best quality. But he at least knew which button to press and what to do, and how to adjust the focus. Now this was something he should have ideally forgotten, but he remembered. One of the things I tell a lot of people to do with patients with dementia is what I refer to as reminiscence therapy, wherein I tell them, remove all the black and white photographs of their childhood, of their marriage, show them that you never know what memory chords can be ignited, and you never know what he might feel nice about or talk about and say things about, which you would never know. And reminiscence therapy, in fact, is a recognized therapy for dementia, and that is something which should be done. What's very important is, while we are caring for dementia patients, let us not forget that this was someone who was a fine human being at one time. Even today, he's a fine human being. It's just that he's probably in another world and he doesn't remember us. So let us remember those who can't remember. Thank you.
Thank you, sir. Thank you. This was a wonderful presentation. Really, thank you so much for taking special efforts to attend this session. You have explained the caregiving process. Thank you so much, sir. This was a really wonderful presentation by you. Thank you.
So, doctor, you decided to give your husband coconut oil. What were your expectations, and what did you see in really a relatively short amount of time?
Yeah, well, the interesting thing in the patent application, their pilot study, they showed that people after the first dose had improved scores on cognitive testing. It was something like 5 out of 7 tests that they did. They had improved scores. And but the other thing too was that people who were apolipoprotein E4 negative were much more likely to improve. The people who were positive for that gene as a group did not improve. And Steve, I knew at that point, was positive for that gene, so I didn't really expect anything. I didn't expect any improvement for him, but I felt like, what do we have to lose? Basically what happened, he went to the first screening. This was like at 1 a.m. that I learned this information, and the screening was at 9 a.m. the next morning, so I didn't have time to run out and buy coconut oil. So we went to that screening, and he still didn't qualify. He got a score of 14 out of 30. He qualified in every other respect, but not that. The interesting thing that happened that day that ties into the long story, the longer version, is that she had him draw a clock too, and it was the clock test for Alzheimer's. It's a very specific test that can kind of see where a person's at, mild, moderate, severe, based on the test. And he drew a few little random circles and a few numbers, and it really wasn't organized like a clock. And that was a bit shocking for me to see, and she told me that she felt he was on the verge of severe Alzheimer's. And I myself felt that he was kind of on a downward spiral at that point. So on the way home, I thought, what have we got to lose? I'm going to go pick up some coconut oil. So I made a big detour about an hour away from where we live to the only place I had ever seen it, and it's everywhere, but I didn't know that at that point, and picked up some coconut oil. And when I got home, I researched coconut oil, had to kind of do a little biochemistry 101 refresher, like which are the medium chain triglycerides, and I was able to find a fatty acid analysis breakdown. It's on the USDA website, and I figured out that coconut oil is almost 60% medium chain triglycerides. And from the dose that they were using for this medical food, I was able to figure out how much coconut oil to give Steve, and that turned out to be a little over 2 tablespoons
Okay.
was equivalent to their dose. So the next morning, he had a screening scheduled at 1 in the afternoon, and for breakfast I gave him a little over 2 tablespoons of coconut oil. I put it into oatmeal because coconut was a little bit solid at room temperature, and he ate it without any problem. I actually had a little bit of indigestion myself. I took it too. I thought, I'm not going to make him take something that I won't take. And his screening was scheduled for 1 in the afternoon, and on the way down, I tried to remind him what the day of the week was and the season. He couldn't even pull the word spring out, he couldn't remember the word, and I really didn't think he was going to do any better. And when we got down there, they took him away, and he came back in the room, and he didn't really feel like he had done very well in the test, but a nurse came in, and she starts taking his blood pressure and talking about drawing blood, and I said, what's happening? And she said, well, he scored an 18, and he actually met the criteria for the study. So we were overjoyed.
Yeah.
And I didn't really know at that point if it was the coconut oil, good luck, prayers, what it was exactly, but decided that we would keep the coconut oil going, and just researched everything I could get my hands on about ketones, medium chain triglycerides, coconut oil, gave him a little over 2 tablespoons every morning for breakfast. So I measured it out and then started cooking with it the rest of the day. I just started substituting it for other things in the diet. And what I found, in addition to, the improved score, was that he was more alert in the morning. He used to come out very sluggish and not very conversant in the morning, and he couldn't find, remember how to get water out of the refrigerator door, and, confusion about utensils and things like that. And he just came out with a lot more energy and more animation in his face, more personality, joking with me, could find the water, these kind of things started happening. And about the 4th or 5th day into it, we talked about how that our life had changed for the better. I mean, he felt so much better, and he said to him it was like the light switch went on the day he started the coconut oil, that a fog lifted, and he really felt like he had gotten his life back and had hope for the future. He'd been quite depressed up to that point.
So you continue to see improvement over the weeks and months. What happens when, ultimately you're going to forget a dose, or something's going to happen, travel appointments or something. Did you notice anything on those days too?
Yes, we did have a couple of occasions like that. He one time he had fasting blood work, and the line was so long that it was noon by the time he had gotten his dose of coconut oil. But he was very shaky, and he felt a little claustrophobic, and he had trouble. His tremor. He had a tremor that had basically gone away, and that came back, and just more confused. And 20 to 30 minutes after we gave him the coconut oil, then he almost like sighs, and the tremor goes away, and he can think more clearly. So we had a couple of occasions that we saw that happen. So it literally acts like an energy, and if you don't have it, it's like if your tank runs out of gas, your car doesn't run. And it was almost something like that we were seeing.